It's time now to check in with Walt Grayson in the Mississippi Moment Corner. And Walt, you seem to have something on your mind today. Tell us about it.
Well, yeah, over the past year, you know, the state's tackled a couple of tough subjects many of us thought would never be taken up in Mississippi. You know, we changed the state flag and we enacted medical marijuana. So I thought while we were on a roll, let's take on expanding Medicaid while we're at it. Now, I didn't just hop out of bed one morning and come up with this idea. Well, maybe I did sort of. I hopped out of bed and started checking my email a few days ago, and the banner article in the Daily Mississippi Today email was from Luke Ramseth about how Mississippi's leaving $1 billion on the table every year that we could be using to provide health care to about 170,000 people who make too much money to qualify for Medicaid, but too little to participate in the Affordable Health Care Act. Now, the $1 billion federal dollars isn't free. The state would have to pick up the tab on 10% of it, or about $100 million, which the state can't afford. However, in the article, Luke says that the Mississippi Hospital Association has come up with a plan where the state wouldn't have to pay that 10%. Hospitals would pay a tax, and then also participants in the plan could pay $20 a month, as well as a copay when they go to the doctor. And they call the plan Mississippi Cares. And the hospitals win because they're already having to pick up the tab when patients can't pay their medical bills. And emergency rooms can't turn anyone away, no matter what their financial status. But under the Mississippi Cares, the hospitals would finally get paid with expanded Medicaid funds. And if patients had medical coverage, they could actually go to a Family Dollar and quit clogging up emergency rooms with non-emergency issues, simply because emergency rooms are right now the only place they can go see a doctor without having to pay. And maybe doing all this, Mississippi could get out of 50th place in health care without it costing taxpayers that $100 million that we can't afford. Now, will all this work? I don't have a clue. But none of us will have a clue if we don't at least give it a good discussion and just quit dismissing Medicaid expansion with no more explanation than I said I don't want it. You know, that's kind of like reasoning. That reasoning works on a 6-year-old, you know, when you say no because I said so. But I think over the past year, Mississippi has proved we're not a bunch of 6-year-olds. And if people that we've elected to take on the tough issues keep dismissing them, then we can probably expect to see more of those issues keep showing up as ballot referendums.